Good morning and welcome to Monday Mornings with Margie. Happy to have you here listening or viewing our show. I have two special guests with me this week that I'm looking forward to having a good conversation with today. I'm going to let them start off by introducing themselves to you all.
Hello, everybody. My name is Dennis Leary. I am an addictions counselor and a healthcare quality professional with Aware Recovery Care.
Hi, everyone. So happy to be here. My name is Courtney MacNeill, and I am the clinical outreach manager with Aware Recovery Care and also a licensed social worker in the state of Connecticut.
Great. So why don't you tell us, it's great to have you guys here. So why don't you tell our viewers a little bit about your organization, what you do, where you're located?
Right. So as I said, we're with Aware Recovery Care. Aware Recovery Care is a Joint Commission accredited addiction treatment program. We deliver care to clients in the home, and we're a year-long program. So we deliver care in the home to the client so they don't have to endure the trauma that's endured by going away to treatment to a brick and mortar location that's associated with addiction and or mental health. So what we've seen is great outcomes and dramatic increases in quality of life indicators by delivering care to clients in the safety of their own home, by being able to work with clients and their families right within their sociocultural environment.
Awesome. And so what areas do you cover? I mean, obviously you're going into homes, but so if I was a person interested, what are the areas that you all are in?
Right. So we're in 6 states right now. So we are in Massachusetts, we are in Maine, we are in New Hampshire, Connecticut, we're in Florida and Indiana. In each of those states, we are regionalized. So we are a mobile-based company. So we have, I'll call them a hub, right? So we have central office hubs. However, the teams are mobile and regionalized. So we service statewide within those states.
Wow. Okay. And in as far as insurance goes, I would assume in different states, you take different insurances and so forth.
Correct. So we are in network with Anthem Blue Cross Blue Shield, Tufts, Beacon Unicare, Florida Blue, VCCN, which is a Veterans Administration insurance in Maine. And Courtney, I believe that's all of them. Did I miss anything?
Did you say Tufts?
Yep.
Then that's it.
Okay.
And we're always in negotiation with other insurance companies. And we've also had great luck with both out-of-network benefits and single case agreements.
Yeah, that's great. So Courtney, do you want to tell me a little bit about what it looks like? Because I mean, I'm super interested in this whole concept. After working in this field now for 20 plus years, this is a really interesting concept to me of substance abuse treatment. And I'm very excited about this concept because I've seen, you know, the hardships that go with the other options at times, not for everyone. So could you tell me and the viewers a little bit about what it looks like to provide care for someone with addiction issues in the home?
Absolutely. I've worked in multiple levels of care. I've worked in detox, residential, IOP, standard outpatient, and I always felt that the missing piece was, what happens after the client is discharged. We have rock stars in groups that really, really have it and they get it. But then we would see them come right back, sometimes as short as 24 hours later, because of the lack of support upon returning home.
Right.
So being able to provide services in the home, really having eyes, I think that's a really big piece, is having eyes on their environment. Sometimes things that they may not even pick up on that are unhealthy, and really being able to develop that rapport as well in their home. We focus on full wraparound services. So we set all of our clients up with an individual therapist, a primary care physician, a psychiatrist, and a family therapist. And we have a full family component as well. So the family actually receives their own treatment team essentially as well. They're receiving family education on healthy boundaries, biology of addiction, coping skills, the things that they need to be able to best support themselves and then in turn best support their loved ones.
And the thing that's great along with that, Margie, is our model is community integrated. And as Courtney mentioned, we source all of our clients with PCPs and therapists and other community providers. Our care coordinators, which are master's level clinicians and or nurses, work collaboratively with those providers and form strength-based treatment plans, and then continue the work in the home that the clients are already doing with the therapists in their offices or the doctors within their offices. Because what we know clinically is change doesn't happen in the group. Change doesn't happen in the session with the therapist. Change happens when they're back in their sociocultural community, back in their, with their peer group associations, trying to utilize those coping mechanisms and those skill sets that they're working on with their therapist. And so what our care teams do is continue that work and help the client be able to use those skills that they're working on in therapy or in group right there in their community.
That's great. Now, are there services like this in other states, like that you guys aren't involved, or are you sort of new on the cutting edge of all of this?
We're the only ones doing that. What we're doing, as a matter of fact, something that we're really proud of is we are the only agency in the country that is dually accredited by the Joint Commission in both behavioral health and home health. So you might have some agencies out there that offer recovery coaching. You might have some places out there that offers some form of something else. I mean, there are some places out there that do some in-home family therapy, but there's nothing out there that's in-home addiction treatment. We're the only treatment center out there that's offering that. And we've been around at its inception, we've been around since 2011, and proof of concept was done shortly after that. We got our contract with Blue Cross Blue Shield since 2015. So we've been around a little while. We're still babies in the addiction treatment world, of course, but we've been around for a little while.
Wow. Well, that's great. That's great. Well, I'm glad to have you on to talk about, the services you're offering, and also just to talk in general about addiction and mental health and how they're intertwined. Obviously at Achieve here, we're treating people primarily with depression. Often anxiety, is paired with depression, as I'm sure you know. And, we deal with a fair amount of people with dual diagnosis, substance use and depression. So that's why I thought it was important, to have an opportunity to talk about these two things. So I guess to segue into talking more about the population and these issues of the people you treat, and you may not have the exact statistics, but generally, what would you say is the percentage of people who have dual diagnosis of substance use and depression, or substance use and anxiety?
Hi,
Yeah.
Nan.
Oh, go ahead, Dennis.
I'm sorry. Did you want to take this, Courtney?
I was just going to say, I have been in the field going on 9 years now, and even not just at Aware, I feel like I've never assessed somebody that didn't have something when they have substance use disorder. Sometimes they're not aware of their diagnosis. Sometimes they don't realize that they've endured trauma. But I would definitely, I never like to say 100%, but definitely in the high 90s, I would say, have dual diagnosis. And we often say substance abuse is just a symptom of a larger problem. So they really go hand in hand.
And you raise a good point too about trauma and PTSD. Not that everyone who's had trauma has PTSD, but I think that is another common dual diagnosis with substance abuse is PTSD or previous trauma that has led to depression and anxiety as
Mhm.
well.
Well, when
Um,
you, I'm sorry.
no, it's okay. Go.
When you think of when you think of addiction as a whole, right? There's so many different layers. And there's so many different subsets. So if you take it's a marginalized community a- as a whole. And then when you take the different demographics of people that um, live with substance use disorder. So for instance, I'm also spearheading access to treatment for the LGBTQ plus community, right? When you take that community into account, there's so many different layers to the stigma that community endures, right? And so there's so many different pressures that community endures, so much community stress, minority stress, so much trauma on many different levels. And all of that together contributes to compounded trauma, compounded anxiety, which contributes to further depression, which contributes to, seeking, you know, um, alternative places, safe spaces to go to, which are generally bars, which contributes to what's available at bars, substances and drinks, which contributes to further use. And so there's so many different layers and so many different, and that's just one area, right? And then when you look at, another population, take the student population, pressures to make finals, what's readily available on campus, Adderall, alcohol, so cigarettes, nicotine, and all of these things create lots of stress, right? Stress creates, a whole bunch of different factors that can create other forms of mental health disorders, right? So while I would probably say, and Courtney, feel free to jump in here at any time, I would definitely say the most common that I've seen, and I've been in the field since 2011, the most common that I've seen is usually generalized anxiety disorder combined with some form of major depressive disorder, right? But usually as a precursor to that, there's trauma. There's, in again, like Courtney, I don't ever like to say 100%, but as close to 100% without saying 100%. There's trauma as well as some psychocontextual factors going along with that, going back to family of origin.
Okay. Yeah. I mean, I think that makes a lot of sense. I think that from my background in working in mental health, I think historically I've been out of doing, treatment, actual in the trenches work now for 4.5 years. But, often there is a misconception, I think, that when somebody gets sober and they're experiencing depression and anxiety, that it's solely because they no longer have the substance.
Mm.
And so then there's a sense of like, well, their brain isn't going to be normal for a while. So, of course, they're going to feel these things, and they have no other coping skills. So, of course, they're going to feel these things. So, we shouldn't go in and treat that right away. And it's good to hear what you all are saying, because I think so much of preventing relapse is treating the whole thing, treating the addiction and treating the depression, the anxiety, the trauma, whatever that is, together to help people to be successful in not relapsing. So it's good to hear kind of your perspective. So I wanted to get your sense, because we're sort of in an unusual time right now, with COVID. With COVID for the last year, with people being isolated, with lots of different kinds of losses for people. I mean, some are family or friends dying, but just, baseline losses of, being able to go out and do things we normally would do, not being able to see significant people in your life. So I'm curious how this is presented with the people that you all are working with. And I guess Courtney, if you want to take this one.
Yeah, absolutely. So kind of going back to that trauma piece as well, sociocultural trauma is a thing. And now us as a nation have experienced COVID together, and that was traumatic. It affected people in different ways, but that has an impact. With Aware, luckily, we did see a raise in our census. So people are still getting help, but it was like the perfect storm. You have these folks that even if they do have all of these identified coping skills, big one is going to meetings, having that sober network. And then, you take all of these coping skills, they have to kind of scramble, and then you put them isolated by themselves. It's perfect storm.
Hmm. Well, it's so how did you all handle did where you guys do in-home services? Did you have to go to more of a telehealth model or
Yeah, so we did more of a hybrid approach, and it's always dependent on the client and the staff's comfortability, but we were able to see clients up to 2 times a week in person. Sometimes that looked like going to a park, going for a walk, grabbing coffee, but we were able to do that. And we had the use of technology as well. We utilized the SoberLink device. That's a portable GPS monitored breathalyzer that individuals can use for accountability. We have a app that, again, completely voluntary, but that has GPS monitoring. So if, say, they're not being seen in person and they, oh gosh, they're over in Hartford or where they know that is probably not the best location for them, they can have support. And Dennis, am I forgetting any of our technology?
Not really forgetting anything. I think what was great was that because we're a mobile-based company already, we were already using telehealth in advance, right? So like, because we believe in meeting the client where they're at physically, mentally, just literally in every way, shape, form, or fashion. So we were already primed. We already had telehealth technology in place in case a client was not able to make their appointment and we needed to make an appointment on the fly. So we have strict infection control policies in place already. So when COVID hit, I don't want to say it wasn't a big disruption to our services, but it had minimal impact on our operations because we were already so prepared. So we were already kind of doing telehealth already. So it was just a few modifications. We just had to order some PPE and we were already in place.
Great, great. So I wanted to talk a little bit, you mentioned earlier about the supports you provide to family and loved ones of people with addiction. And that's interesting that you have that service because that was one of, when I was thinking about this discussion, I was thinking about not only the people I have worked with in an outpatient setting or inpatient setting that had addiction, but often their families that were suffering and many times didn't feel like they could share what was happening with a lot of other people because of the stigma and feeling judged by other people. And so I was curious as to what are your, suggestions, maybe a short version of what your suggestions are when you're working with families or loved ones of people with addiction. What are some of the either resources or just sort of things that you emphasize for them? So if you were someone listening to us who's struggling with either their child, maybe they're a youth or they have a significant other that's using, what are some of your suggestions?
So for me, I would say probably the biggest thing is education, psychoeducation on addiction and what their loved one is going through. Family members and loved ones, friends, oftentimes take on so many different roles when they have a loved one with substance use disorder. You know, they're the parent or spouse, but they're also a therapist. They're also security guard, making sure they're where they need to be, things like that. So really being able to educate yourself on where to draw those lines in the sand and where to have those boundaries, you know, is really, really important. And sometimes, you know, enabling, sometimes it feels like you're helping. How are you going to look at a loved one and be like, you know, no, I'm cutting you off. But in reality, that's something that ends up enabling the person to continue using. So learning about that, having support, attending meetings like Al-Anon or having a therapist. And another really big one is, I think, identifying those boundaries and talking about them right off the bat, so that if something happens, you know, a recurrence occurs, those outcomes are already discussed and established, instead of trying to, in the heat of the moment, figure out what to do.
Mhm. So in fact, the person with the addiction and the significant other or family member know up front.
Yeah, absolutely.
Both parties know up front what the consequences will be if and when something happens.
Absolutely.
I think that makes a lot of sense, because it's hard in those moments when the relapse occurs, for people to make those kind of decisions. I've
Absolutely.
worked with a lot of parents, and it's such a painful process, to watch your child, you know, struggling, and you can only do so much, and you don't want to enable, but you are worried about the outcome for your child. It's rough. It
Yeah.
is a rough thing, and a lot of loss and grief with that as well.
Mm.
So going back to people with addiction, what are some of the main resources? I mean, obviously you guys are a resource yourself, but what other kind of resources would you say are out there for people who are, you know, either trying to get sober or clean for the first time, or have had issues with relapsing and haven't been able to maintain sobriety? What are some of the resources that you guys recommend to people, to look for?
Right? So there's always self-help groups, right? So there's always, and there's, you know, it's estimated that there is 24 million people in the United States with a substance use disorder. So there's 24 million ways to recover.
Mhm.
And so what works for one doesn't work for another. But so I always promote self-help. So there's, you know, there's 800 numbers for everything that I am about to say. So there's Alcoholics Anonymous, there's all the A's, AA, Cocaine Anonymous, Meth Anonymous, but then there's also more holistic methods, Refuge Recovery. There is Smart Recovery. Courtney, do you want to just mention a few?
Yeah, recovery yoga, things like that. I think it's really about also developing that support system. So I've had clients in the past who didn't really like meetings, but they had a sober bowling club, and you know that worked for them. And really just kind of identifying what those are, and the more support that you can have, you know, the more success. You hit the nail on the head. When everybody is involved and, you know, kind of working together as a team for that one person, that's when success happens.
Sober meetups are a really great one
Yeah.
too. And if anybody listening knows anyone that is looking for positive activities, you can look at recovery-based meetups online, and people are doing things that are positive.
That's great. That's great. Because that is something I also ran into in working with people, that AA isn't for everybody.
Absolutely.
And it's always hard in determining, is that true, or is that an excuse?
Mhm.
And so you're also trying to help guide people. But I always felt like, there needs to be more than one road, because like you said, one form of treatment isn't the right form of treatment for everybody. And so I like your whole thing about 800, people, and 800 different ways to get, help or sober.
Mhm.
So I guess I wanted to wrap up. I'm just thinking about our youth, um, and how there's so much available. I mean, I know there's been things available for a long time. And maybe it's because I'm the parent of an adolescent and a soon to be adolescent. So I'm much more sort of aware of this. But what are some of the things that you would suggest to parents? Not necessarily, I mean, parents who have kids that are using, but just about how do you talk to kids, whether you suspect they're using or whether you want to prevent them from starting to use. What are some of the suggestions you have for people out there? Because I think a lot of parents really struggle with this, and it's an experimental phase in their life. And then, you know, but there's a lot of things out there that that can have really bad outcomes.
Yeah, I think that, so I'm a parent of 5, right? I have 5 myself, my husband and I. And I think for starters, I know that one thing for prevention people can do is you can reduce your child's chances of developing a substance use disorder by sitting down as a family and having dinner 3 times a week and engaging as a family and talking. So that's one thing you can do to prevent. Also, I think in determining another way of broaching the subject, a lot of times we don't understand what our child knows. So ask your client in age appropriate language what they know. Find out what they know about drugs. And you can just say, and you can say just that. So what do you know about marijuana? What do you know about, cigarettes? What do you know about alcohol? And use that as a jumping off point. And then, I also have a 14-year-old, and I talk to him very openly. He knows what I do for work. What are kids doing in school these days? And no shaming language, right? Because you would much rather know what your kid is doing and have them develop a relationship with you, because then you can talk about it. We have a code with my son. IID. If he texts us IID, it means I'm in danger, and we go get him with no questions asked. He hasn't had to use it yet. We'll talk about it the next day, but there's no questions asked because safety is paramount. And again, no shaming behavior, because if a kid thinks that that you're going to embarrass them or that they're going to be in trouble, they're never going to tell you anything. And we tell our kid all the time that doesn't mean that there's not going to be accountability or ramifications for your actions. But you can come to us and we're going to give you the truth, and we're going to talk to you, and we're going to give you the right answers. Don't trust Google. Don't trust, outside sources. Come to your parents. And he does. And he does. He comes to us about subjects that, traditionally children would be embarrassed to talk to their parents about.
Yeah, I completely agree, Dennis. I think just that creation of a open and trusting environment, a lot of times when working with families and loved ones, we see more of either this is a really uncomfortable topic or not my kid, and not wanting to bring it up, and they kind of push it to the side, or we have more of the helicopter parent who's really just kind of hovering and watching over, and then that kind of creates a fear-based decision making. But to have that openness and to have your child feel comfortable and safe to come to you, because if they're doing it, you'd rather have that uncomfortable conversation and know about it and have them feel safe and able to come to you, rather than the alternative.
Makes a lot of sense. And I was thinking too about vaping, because I know that's a huge issue, and I think there's a lot of stuff that we don't know about it, but what we do know, and the more we know about it, is that it's really terrible. So that, that's another whole thing happening. But anyways, well, I appreciate you. I appreciate your time. I appreciate your expertise and having you share what your organization is doing, and then also some of the things that you found helpful in working with people with addiction, as well as their families and loved ones. So, as a former, well, I'm always going to be a social worker, but as a former treating social worker, I applaud you for the work that you're doing, because it's really important work, and it's really in the trenches, and I'm sure you're helping a lot of people and a lot of families.
Thank you so much.
And thank you for the work that you're doing by treating and breaking down barriers for people with depression and anxiety.
Absolutely. We got to talk about it. It's just like
We
what you
do. Yes.
Mhm. Absolutely.
has to be discussed because it's real.
Mhm.
And it's not discussed or dealt with enough. So that's my goal is, putting things out there. So I appreciate your time. And thank you all for listening or watching this week. And I will see you next week. And I hope that you have a very good week. Take care.
Thank you.